Dr. Molaski, it's so great to have you here. And let's talk about women's heart health versus men's heart health. So does heart disease affect women differently than men?
Thank you so much for having me, Melissa. I'm thrilled to be here. And yes, absolutely, heart disease affects women differently than men. We know that from lots of years of research. The risk factors for disease are different for women than men. There are common risk factors such as diabetes and smoking that have more of an impact on your likelihood of developing disease as a woman than a man. And then there are gender-specific risk factors such as pregnancy-associated things like eclampsia or toxemia, gestational diabetes, polycystic ovarian syndrome. All of those increase your risk of developing disease as a woman. And then there are autoimmune disorders and inflammatory disorders such as rheumatoid arthritis and lupus that very specifically hit women much more and have an increase in risk of heart disease. So that's the first area. And then we know that women suffer from different mechanisms of disease. So besides a typical blocked artery heart attack, women tend to have arterial dysfunction, small vessel disease, or the artery spasming. That's much more likely in women and can cause heart attack. They can have a tear in the lining of their artery as a cause of a heart attack, and that's very unusual in men. 90% of that occurs in women as opposed to men.
Wow.
And then we know that they tend to be undertreated. They don't access care readily. They are delays in care. They don't get guideline-driven treatments. They're less represented in clinical trials, and that all translates into worse outcomes, unfortunately.
Okay, and you had talked about seeking medical treatment. So help us understand the signs of heart attack in a woman, and when should a woman seek that medical treatment?
That's a great question. You know, women and men tend to have chest discomfort or chest heaviness when they're having a heart attack. But what we know is that the main symptom that women have is often not the chest pressure. They present with shortness of breath or nausea or fatigue, much more subtle symptoms. When asked if they also have chest discomfort, then they say yes, but they're much less likely to present with that as the primary symptom. And so they may get delays in care as a result of that. And we know that women are less likely to access medical care. So they did one survey recently where they asked women if they thought they were having a heart attack, would they call 911? And only 50% of them said that if they thought they were having a heart attack, they would call 911.
Really?
We know that that also translates into worse outcomes, that if you access care early, you improve your likelihood of surviving and having less injury from a heart attack. So very important information.
Wow, my goodness. I wonder if that's a reflection too of women being like caregivers and always putting others before themselves and going, oh, I'm fine, it's okay, it's nothing that bad, I just ate something bad.
Yeah, heavy denial, and also a big lack of awareness about the risk of heart disease to women.
How it presents differently, like you said.
Well, and not just that, but just also a recognition that it's a risk to yourself, that when they surveyed women, we've actually lost ground since 1997, that only 44% of women know that heart disease is the #1 killer of women, and only 16% think it's a risk to their own health. So there's this gap in understanding. Even if you know it's a major risk, you don't think it's your risk.
Yes,
so you don't
happen to
seek care.
somebody else, not
Right.
you. All right, so tell us though more about St. Al's Women's Heart Care and Cardio-Oncology program.
Well, I'm very proud of this program. We started it in 2011, and it started out as just St. Alphonsus Women's Heart Care, and we wanted to create a specialized program that met the needs for women, provided accessible care, and really had a tailored expert approach to women and heart disease, knowing that there were differences in heart disease. And we also wanted to educate the community and the providers in the community to improve care and reduce disparities in care for women. And St. Alphonsus has been completely supportive of that mission from the beginning, and the program has been very successful. We provided care to over 10,000 women. We have done community outreach. We have supported the American Heart Association Go Red for Women campaign. We got a chapter of the Women Heart, which is a national advocacy group for women with heart disease, started in Idaho, and we have a very active chapter run by one of my patients. And we held a community educational conference every year on women and heart disease for providers that's been very well subscribed to. And so I think we've really made a significant difference in care in the community. We expanded to include cardio-oncology a few years ago and officially opened just this year in recognition that there was a significant intersection between heart disease and oncology, and cancer is the second leading cause of death in women, and it also affects men as well. But the reason it came under the umbrella of women's heart care is that women tend to be more susceptible to the negative effects of chemotherapy, and they tend to be more vulnerable to developing toxicity from chemotherapy. And that is in part because of the high incidence of breast cancer and the use of certain therapies for breast cancer. So the program is growing, but I think the most important thing is that we also provide a focus of expertise and work collaboratively with the other providers at the St. Alphonsus Heart Institute to make sure that women are getting the best care everywhere in our program.
So well said, such an important message. Okay, where can people go so they can learn more?
Well, they can go to stalphonsus.org and then type in Women's Heart Health, and the Women's Heart Care program will come up.
Thank you so much.
Thank you so much for having me.